All right, let's dive into one of the most complex things in the entire universe, the human brain. Today, we're going to become medical detectives. We're tackling two incredibly tricky cases where all the clues, all the secrets are buried deep inside the mind.
I mean, think about it. How do you possibly solve a mystery when the crime scene is the brain itself? This is some serious, high-stakes detective work. When a person's entire reality starts to fall apart, neurologists are the ones who have to piece together these tiny, subtle clues to figure out what's really going on.
So that's what we're going to do. We're going to step right into a neurologist's shoes and crack two real case files together. You ready? Let's open up the first one. Our first case is a really unsettling one. We're calling it the memory thief, and you'll see why. Because for our patient, the most important parts of who she is are just vanishing. Okay, try to imagine this. Over just 1 month, 30 days, your world starts to completely unravel. That's exactly what's happening to this 48-year-old woman. Her memories, her sense of who she is, it's all coming undone, and nobody has a clue why. So let's look at the evidence, the symptoms. We're talking about really rapid memory loss. This isn't just, forgetting your keys. This is forgetting major life events, maybe even people. On top of that, she's confused. She's having these terrifying seizures for the first time in her life. She can't sleep, and her emotions are all over the place. It's a total nightmare.
All right, this is where the clues start coming in. First up, the brain MRI. It shows these bright, glowing spots right in the brain's memory centers. That tells us exactly where the damage is happening. Next, they do a spinal tap. It shows there's inflammation, but, and this is super important, no signs of a virus or bacteria, so it's not a typical infection. And then we get the smoking gun. A blood test finds these rogue antibodies, specifically something called anti-LGI1 antibodies. These are supposed to be the body's own soldiers, but they've gone rogue and are attacking a crucial protein in the brain.
Okay, you're the doctor now. You've got all the evidence, the brain is on fire with inflammation, we know it's not a regular infection, and the body's own immune system is the #1 suspect. So what's the call? Do you hit it with antibiotics, antivirals? Do you just try to manage the seizures? Or do you go after the immune system itself?
And the diagnosis, thanks to those specific antibodies, is limbic encephalitis. It's an autoimmune disease. Basically, the body's security system has gotten confused and decided that the brain, its own command center, is the enemy. It's launched a full-on attack against itself. And that's why choosing the right path is everything. Option A, the methylprednisolone, is an immunosuppressant. It's the only thing on this list that directly tells the immune system, hey, stand down. The other options? Total dead ends. Antibiotics and antivirals would do nothing because there's no outside invader to fight. And seizure medication? Well, that's just putting a Band-Aid on one symptom while the fire rages underneath. You have to treat the cause, not just the chaos it creates.
Nicely done. We've caught the memory thief and figured out the case. But we're not done yet. Our next puzzle seems totally different. It has nothing to do with the immune system. But stick with me because there's a really surprising hidden connection between these two cases. All right, on to our second investigation. This one is all about a condition that looks exactly like a stroke, feels like a stroke, but it's something else entirely. We're calling this one the imposter stroke. So meet our patient. She's only 14 years old. And she's having these terrifying episodes where she gets weak on one side of her body and even loses her vision. Now, those are textbook stroke symptoms, but a stroke in a 14-year-old, that is incredibly rare. Something here just doesn't add up. Let's look at the whole file. Besides these stroke-like events, there are other clues that seem, totally unrelated. She has a history of hearing problems. She's always been short for her age. She gets these really bad headaches. See? These aren't things you normally see with a stroke. It's a big hint that maybe the problem isn't just in one part of the brain. It might be something affecting her whole body. So the team digs deeper, and this is where the case just blows wide open. Her brain MRI shows damage, for sure, but the damaged spots don't follow the map of any single blood vessel. A real stroke is like a blocked river. It only affects the land that river feeds. This was different. Then a blood test shows high levels of lactate, which is a huge red flag that her cells are struggling to make energy. And finally, the genetic test finds it, a mutation in her mitochondrial DNA. Okay, detective, time to put it all together. We've got stroke-like episodes that aren't really strokes. We've got an energy crisis happening in all her cells, and we have a specific genetic fingerprint. So What's the diagnosis? The answer is B, MELAS syndrome. And what's amazing is the name itself is basically a summary of all the clues. It's a genetic disorder where the mitochondria, which are like the tiny little power plants inside every single one of our cells, are broken. This leads to a massive body-wide power failure, which causes all the symptoms, including those imposter strucks. And here's how we know it's the right call. MELAS is the only diagnosis that connects every single dot. A true stroke wouldn't explain the high lactate or the weird pattern of brain damage. Multiple sclerosis can mimic a lot of things, but it doesn't fit the genetic or metabolic clues at all. By refusing to accept the easy answer, the team unmasked the imposter and found the real culprit. So, wow, we've cracked two really, really tough cases. But what's the big takeaway here? What does this all tell us about the art of figuring this stuff out? I think the most important lesson is this. The symptoms are never the whole story. They're just the tip of the iceberg. Treating the seizure in the first case or the stroke-like episode in the second, well, that would have been a temporary fix at best. The real answer, the real path to helping these patients, lies in digging way deeper to find the root cause. You can really boil this entire process down to a simple method. First, you have to listen. Really listen to the patient's entire story, not just the most dramatic symptom. Second, you gather all the clues you possibly can. Third, you connect those clues to find that single root cause. And it's only then, once you've done all that, that you can confidently choose the right way forward. Ultimately, it really all comes down to this. Modern medicine is all about building a bridge between the human side of being sick, the patient's story, and the cold, hard data from our technology. And the answer, the real diagnosis, is always, always found right where those two things meet. And that brings us back to that hidden connection I mentioned. We looked at two totally different problems, right? An immune system gone wild and a genetic flaw in our cellular power plants. So what's the common thread? In both cases, the threat wasn't from the outside. The enemy was already inside. One was a betrayal by the body's own protectors, and the other was a fundamental failure in its energy source. It just goes to show how fragile our health really is. It all depends on this delicate truce inside our own bodies. Thanks for joining me on this investigation.